All right, well, we have the top of the hour. I think looks like most folks are with us, so we will go ahead and get started. Andy, would you like to start us off?
Sure, happy to, Diane. It's good to be with everybody today. And today we've got some really exciting news that we're going to share with you. And we've also got some challenging news to share with you as well. And so it's a little bit of a mixed bag. And as we think about some of the numbers that Dr. Lewis is going to talk to you about, it just sort of highlights the need for all of us to continue to really do our best in the communities over the next few weeks and the holidays to make sure that we're doing all the things we need to do to stay safe and to keep our loved ones safe and people we care about in the community safe. So with that, I'm going to turn it over to Dr. Lewis to give us a bunch of updates.
All right, thank you, Dr. Muller. So good morning, everybody. So as Dr. Muller alluded to, there is some good news and bad news here. I'll start, frankly, with the bad news, which is giving you the mid-December COVID update for our hospital census, which is currently with our floor. We have 58 positive COVID patients on the floor. ICU level care is 13, has 13 COVID patients. 8 of those are ventilated, and that's for a total of 71 COVID positive patients that we have at Lynchburg General. Now that number, you may recall early in December when we came to our last press conference, we were reporting out 56 positive patients in our facility. So over about 2 weeks of December, we've really increased significantly by 15 patients. And a lot of that increase, frankly, has happened over the last weekend and into this week. And so we are seeing a trend that is somewhat ominous. We'll have to see where this goes, and hopefully it will stabilize, but it certainly is challenging our system right now. I will say also with that, with the increase in COVID patients, you unfortunately do see increased death in the facility of COVID. So when we reported last time, it was 114 deaths at Lynchburg General from COVID, December 2nd. Currently, as of today, we reached 132 deaths due to COVID, so a significant increase. We are concerned that this number will, of course, continue to climb as we see more patients come into the hospital, get sicker, often need to go to the ICU, and then, unfortunately, a portion of them will pass away. So that always does bring up the question of capacity. How much capacity do we have to take care of these patients? So we have had 2 full floors dedicated to COVID for 70 beds total. And 18 of those beds were ICU level beds dedicated just purely to COVID patients. Over the weekend, we did outgrow that footprint, unfortunately, and we needed to open back up the pediatrics floor, which is now purely for COVID patients, and started housing and caring for those patients there as well. We do, in response, we do need to leverage our entire healthcare system and use any bed capacity and staffing that we have at our other facilities, say at Bedford and Southside, and the Baptist, to work as one large organization to make sure we can care for all the patients across these communities. And that does give us some flexibility. Also, I did report previously on the modular unit that we were building outside of the ER. Construction is still underway and is slated to finish December 21st. As you may recall, that is a unit that is meant for COVID possible patients coming in, or patients coming in with respiratory symptoms or other things, possibly COVID, to be evaluated there. It does offload our ER some and allows us to care for also a larger volume of ER influx. So along with that, of course, beyond beds, you need folks to staff it. And our staffing is clearly challenged now and has been, frankly, for some time. Our staff is stretched thin to try and care for all these patients across these many beds. We do hire new caregivers as possible, but as you're also aware, this is a national problem where hiring and bringing on new staff has been strained across everywhere, the whole country. So our caregivers are tired, but they continue to work, and they will continue. We'll all have to continue through the winter season because we think the challenge certainly will not let up. So that's essentially more the bad news first. The good news that Dr. Muller was mentioning was, frankly, the vaccines. And I can report that as of this morning, Lynchburg General did receive its first Pfizer shipment. We received it at 9:14, and it is now, those vials are now currently housed in our ultra cold storage capacity in the pharmacy. We did receive 2,925 doses in this initial shipment. We do expect to start vaccinating as early as tomorrow, knowing that the weather is somewhat suspect, but we would like to start it, and we will slowly ramp it up and scale it as quickly as possible. This is a more complicated vaccine to give, and we need to make sure that we do it right. The last thing you want to do is lose any of these doses because of its ultra cold storage. The handling is very specific. So we will learn our way through it and rapidly expand it as we can. In terms of who we vaccinate, we are going to follow closely CDC guidelines for prioritizing caregivers, which clearly state that our caregivers who are at higher risk should be going first, and we do have lists and we'll be starting with them. The CDC's recommendations come from the fact that they recognize that these caregivers are at the highest risk for getting COVID, just because we're in the hospital and dealing with COVID patients all the time, or even potentially COVID positive patients. But also the CDC recognized that we need to keep our hospitals running. Particularly as we talk about staffing challenges, we need to keep our staff as healthy as possible so that we can continue to care for our community, particularly as COVID seems to be ramping up and becoming more widespread. Some people have made an analogy to airplanes, and when you get instructions to, if oxygen masks drop, that you need to put yours on first, and then you care for those around you and place their oxygen masks on. So similarly, we need to keep our workforce healthy and working so that we can continue to care for the community. So in preparation for this, we have had our Centra COVID Clinical Task Force, which is a group of over 12 clinicians and physicians looking at all the data that has been put out, frankly, fairly recently by the FDA on Pfizer's safety and effectiveness. And we've looked at this data very closely, and they then unanimously voted to recommend to offer the vaccine to all levels of priority groups as outlined by CDC, which includes healthcare workers. I need to stress, and this is of importance, that Centra is going to offer this. We will not mandate this for any of our caregivers. And frankly, nobody in Virginia, none of the healthcare systems in Virginia have reported that they will mandate this vaccine. We will highly recommend it to appropriate groups, but at this point, it is not a requirement. So furthermore, I'd like to say that in general, this vaccine effort, it's frankly the very beginning of this. Many parts of this are still unknown. This level of effort of vaccinating the entire nation in as rapid a way as we can has really been unparalleled. This is a new challenge for all of us, and we'll learn our way through it and try and get everybody vaccinated and as safe as possible, as quickly as possible. What it is going to require is a combined effort on the national level, the state level at Virginia, as well as the Virginia Department of Health, local providers, pharmacies, along with others, all coming together and working to push this vaccine out to try and get to everyone as the vaccine becomes available. Centra will clearly play a significant role in this. However, it is going to be an all-in effort. Everybody's going to have a role to play. Finally, I would like to say, this is truly good news, that vaccines, particularly with the data that we've been seeing coming out of how good they are and how effective they are at preventing us from getting infected, vaccines will frankly be a large part of how we get through this pandemic. The next couple, 3 months are going to be challenging. Vaccines will not change that. We still need to use our, as Dr. Muller says, continue to do our safety behaviors, masking, social distancing, hand washing. because vaccines will take a while to change the course of this pandemic. However, I do believe that springtime will be a brighter time for us, and summer even significantly more bright. And the pandemic has been long, it has been hard, but there is a very significant hope, I think, with the vaccines now coming out as they are. So with that, I'm going to end my speaking part, and I think we'll open it up to questions, if that's okay, Diane.
Yep, that'll be great. We'll take questions.
Hi, Chris, can you hear me?
Yes, I can.
Hi, it's Alexa Massey from the Farmville Herald. Thanks so much for giving the opportunity to ask some questions. Obviously, I've always got Southside and Farmville on the brain. So I was just wondering, a lot of people in our coverage area are wondering how Southside falls in all of this. So I wanted to ask if you all are aware if Southside will be receiving any vaccines anytime in the next couple of weeks, if they will be involved in immunization at all. And then, you know, if so, or if not, the healthcare workers at Southside who are deemed vulnerable, if they will be receiving vaccination anytime soon.
Right, Alexa, that's a great question, and there's a lot to that. So I will say, as you all are aware, the Pfizer vaccine is extra challenging because it requires ultra cold storage. Currently, Lynchburg General is the only hospital in our Centra system that has that capacity. So that's where the Pfizer vaccine will initially come. So our plan is, as long as that's the case, that only Pfizer is out there and we have it here in Lynchburg General, we do plan on vaccinating our caregivers at other facilities. We will just need to bring them to Lynchburg. Again, the challenge is that we have the facility here for the ultra cold, and it is very, it's frankly not allowed to move the vaccine except for very strict conditions where you can move it to other facilities with ultra cold. So we need to preserve the vaccine, make sure it's safe, and so we're going to initially at least plan on bringing people to Lynchburg General, the caregivers, particularly when you ask at Southside. Now, over time, other vaccines will become available. As you're aware, Moderna is likely going to become available at some point in the very near future. That one is easier to store and will frankly likely be able to be sent to many more medical centers that only have regular freezer capacity. So at that point, and I can't tell you exactly when, Farmville may also become a vaccination site and stand that up as well.
Thank you so much, Chris. And then if I could just bother you with one more thing, could you speak just a bit about what COVID data, what numbers are looking like at Southside? Because I know you mentioned that there may be some patients from Lynchburg who are sort of overflowing over there and to other sites. So if you could just speak a minute about what you're seeing there.
Right. So Alexa, you've seen, and you're probably aware, you've seen more COVID activity in your community as well. This is frankly, a national trend, but Southside is certainly not spared from that. The census of COVID positive patients in Farmville has frankly also increased. Previously, we're reporting sort of in the 3 to 5 range. That facility has been able to stretch its capacity and is now carrying usually on the order from between 9 and 11 COVID positive patients. And they've been an integral part of our system of managing and taking care of all these folks. And so we've been able to leverage them to take care of patients both in your community, but at times when we are more stretched, or frankly down in the Gretna ER area, if they are more stretched, we can have folks in Farmville help out as well. So that's what we're seeing. So you all are also stretching out there.
Thank you so much.
Sure.
Dr. Lewis, it's Danner Evans. Could you clarify, are those numbers in addition to what you're housing at Lynchburg General or part of the entire?
Those are in addition, Danner. Okay. So when we're talking system-wide, it is larger than, as of today, 71. So you generally can add, at least at this time, again, between 8 to 11 potential positives to that for the whole system.
Okay. What can you tell us about the patient population that you're treating as far as the age? And, quite frankly, I've talked to Diane on a weekly basis about the number of people who are dying, and I've seen that number jump significantly, I think, in the last month. What can you tell us about that as well, and those patients that we're losing?
Yeah, so Danner, unfortunately, we're losing often the same, general population of patients. The problem is that we're seeing more of them. And so we've seen a significant increase through November, and now we're seeing more into December. So that death rate doesn't seem to appear so much because we're suddenly jumped to a new population that are getting sick. It frankly just is still the same population of, and it's often, as we've talked about, sort of the older individuals, the folks with multiple comorbidities that are the highest risk for death. And they unfortunately are still dying. It's just the more folks that get sick in the community, the more, a percentage of those come to the hospital, and then a percentage of those will go on to the ICU, and some of those will pass away. And as you've seen, the increased rate of COVID in the community really has ramped up, and now we're seeing the downstream effects of that.
Yeah, just to add some perspective, back in October, looking at across the state of Virginia, we were seeing about 800 hospitalized patients across the entire state. Today, we're just shy of 2,400 across the state. So in 2 months, we've more than tripled or almost tripled the number of patients that we're seeing in the hospital. I think compared to what we saw very early on, we are seeing about 10% of our hospitalized patients requiring ventilatory support, which is a lower percentage than what we saw early on. Some of that, I think, reflects the fact that we do have some younger patients in the hospital now compared to what we first saw when there were still nursing home outbreaks early in the pandemic. But the numbers are really high.
So one more follow-up question. When you hear people say this is a phony pandemic or this isn't real, what's your reaction to that, especially as we're seeing a surge right now?
Danner, I don't know. I don't know what to tell you about my reaction. I can tell at the gut level I've reacted a certain way. I really, I wish to some extent we could show them what's happening on our floors and what's happening in our ICUs, what's happening to our caregivers that are trying to care for this pandemic, and the families that are losing loved ones and friends, and sometimes not even able to visit in the way that we'd love for them to visit. So I don't know how otherwise to say it, Danner. I can't take them by the hand and take them bedside and show them this is what's happening here. I just don't know any other way to say that. Andy?
Yeah, I'll add that, I think, we're not in the business of trying to change people's minds or beliefs. At the same time, I think sometimes there are unintended consequences. And I think one of those is to our caregivers who are really literally risking their lives every day to care for these patients. And I think it's awfully disheartening for many of them to hear folks talk about the fact that they don't believe this is real or that it's as impactful as it is, because they are giving so much of themselves in terms of time, energy, sleepless nights, the fear of worrying about contracting this disease themselves, and the fear that they carry with them that they may pass this on to their family members. And so in many ways, clearly, our hearts go out to all of the patients who've suffered with this disease, and certainly those who've lost loved ones from it. But I think sometimes it's difficult to really appreciate the impact this has on our frontline caregivers who are trying so hard to do so much to really care for the community.
Thanks for all you guys are doing.
Thanks, Tanner.
Hi, this is Santiago. Thank you all for doing this again. Had a couple questions. First, a clarifying question. You're reporting 71 in the hospital at the moment. I think that's the highest you've reported so far, but is that the record that you've seen so far?
Santiago, you are correct. That is certainly the highest we've reported. And over the weekend, we really jumped into this 70 range, high 60s to 71. The trajectory is not great. I will tell you that yesterday, for example, we had 69. So we still continue to increase. Luckily, again, a good portion of these will get better and we can discharge them back to home safely. But the more and more, the increased pace of what we see, the infection moving in the community, we just worry about that we're going to get an increased rate of admissions and our numbers are just going to keep going up.
Okay. I had a question about the vaccine. It's kind of more of a scientific question. It has to be stored at -70 degrees, but I imagine you can't just inject -70 degree liquid into someone's body. So what's the process like for thawing it, and how long is its shelf life once it is warmed up?
Right, so great questions, and these are all, and they are quite technical, and we have to be very mindful of them, because if we don't follow them to the T, you then start losing the vaccine because you may render it ineffective. So yes, you do not directly inject it into folks. You couldn't, it's solid at that point. So what you need to do is you take it out of the freezer and you let it thaw. You can either do that in a refrigerator and let it get to refrigeration temperature and liquefy, or you frankly can just put it out to room air. Once it has gotten to that temperature, you reconstitute it, you basically mix it with saline, that sort of thing. And then you have 6 hours to administer it. And that clock really starts ticking, and you have to be mindful of it, because after that, you can't utilize it. So, there are a lot of parameters that make this a challenging vaccine to give, more so than really any others. This is very different than the flu vaccine, which makes it harder to scale and administer and give to all the people who we really need to.
Okay, and my last question at the moment is, we've been seeing reports of people who have recovered from COVID months later throwing blood clots, a whole number of long-term impacts. What are you seeing from patients that you have been able to discharge and maybe have come back?
So that's a good question, Santiago. Are you meaning coming back to the hospital ill and needing to be rehospitalized, or?
Yes, for whatever long-term impacts they may have had post-recovery.
So Santiago, we see some readmissions, but generally it is in the nearer term if they start getting sicker again and needing more oxygen. We are very mindful of trying to make sure that we don't discharge folks and that they really are going the right direction. On occasion that they do start getting ill again and need to come back, but it's not for these more long-term things that I think you're referencing. Some people who say that they have long-term sort of brain fog, fatigue, certainly loss of smell, all sorts of different symptoms that we don't quite fully understand, but we very much recognize that they seem to be there. Those folks often don't get re-hospitalized, but they do have prolonged courses and we still don't know what the total natural history is. A lot of them seem to recover, but some of them struggle for months to continue to have trouble with things like shortness of breath and their exercise tolerance. So more is going to be known about that over time as it's going to be studied, but this still is a fairly young disease experience, right? We've been dealing with it for less than a year, so we will understand it better going forward, but we're still learning our way.
Okay, and finally, my last question. The number of doses that you've received, is that enough to vaccinate all of your caregivers, or are there going to be people who won't make this round?
No, it's not enough to vaccinate all our caregivers. It's a decent start, and the supposition is that more and more vaccine is going to be rolling our way. So what we have to do is, again, stratify our care providers, because Centra has a lot of employees. We need to make sure that we get it to the frontline folks who are at risk, who are interacting with patients and could be getting COVID. So, more to come on that, but over time, more vaccine is going to become available and frankly, be pushed out into the community to be given there as well.
Okay, thank you.
Sure.
Hey, Dr. Lewis, this is Hannah. I just want to thank you guys, but also have a couple questions. Can you explain for anyone who might be watching this later tonight why it's important to get both rounds of that vaccine, not just getting that first shot and just calling it a day?
Okay, sure, Hannah. I can talk. So let me talk a little bit about the science. I'll try not to go into too much detail, but this is an mRNA vaccine. It's a new one. mRNA technology has been around for a long time. We know it, we understand it, but using it in a vaccine on this large a scale is new. The way it works, though, is it basically the mRNA is an instruction to tell our body how to produce a certain protein called the spike protein. It's a very small piece of the shell of the virus, but it's an important piece for the virus. So our body puts out this protein, and then our immune system or our body sees it and attacks it because it doesn't belong. It's not part of us. And once it's done that, it then remembers that spike protein. Now, the second dose that you get is 21 days later or around about there. And what that is doing is letting the body once again see this spike protein and say, hey, remember this. And the immune system once again attacks it, but remembers it even better. And so after that second dose, your body is very attuned to if you then get infected or if a COVID virus gets into your system, it will see the spike protein on that virus and it will right away attack it. And now it's gotten 2 views of this protein and generated an immune response. And the third time it sees it with that virus, it's ready to really get after it and kick it out.
Okay, thank you. And I know last time I asked you this, you guys still weren't sure, but if somebody has already had COVID-19, do they need to get the vaccine? Is it going to do anything for them?
So, Hannah, that's a great question, and I'm happy to say that that's one thing that we can now say something about. Still a lot of questions out there, but I will say that the CDC over the weekend and the FDA did come out with more clarity and recommendations on some of these key points. And currently what they're recommending is that they say, look, even if you've had COVID before, people seem to have varying degrees of immune responses, some very strong, that could well protect them in the future again, but others potentially not as much. So what they are saying is, look, we know that this vaccine really works well to protect you and generate great immunity. So they don't recommend you get it while you're infected with COVID, but anytime after that, they say it is worthwhile to get the vaccine to really make your immune system robust. Now, the caveat, one exception they say is, look, we also don't see that very much at all people get reinfected within 90 days of seeing COVID the first time. So they make it optional, and they say the individual should decide whether or not they want to get vaccinated within that first 90 days, or they may choose to wait after that, because the CDC thinks that we are probably protected at least through the first 90 days. We just don't know enough about what happens after that. Does that make sense?
I think so. Yeah, I appreciate that. Just 2 quick more questions for you. So are the strengths of the first round and the second round of the COVID vaccine we're supposed to get different? Are they different strengths or the exact same thing?
They are identical. They're the same thing over again, just 21 days later.
And is the effectiveness different in regards to which drug manufacturer makes the vaccine, or should people, if people are looking at the different manufacturers, should they get the Pfizer over anything else that comes out later, or is it all pretty much the same formula?
So, Hannah, that's a great question. So we need to be careful. So the Pfizer vaccine is the Pfizer vaccine. There only will be that one that is called Pfizer. If you're starting to talk about Moderna, that is a different company, and the vaccine is slightly different. It's not apples to apples. It's 2 slightly different things. They are both mRNA vaccines, but if you get one, you need to get the same one the second time. So if I get a Pfizer vaccine today, I need to get vaccinated again in 21 days with Pfizer. Same thing with Moderna. If you get vaccinated originally with that, they're saying they have a 28-day window to get the next second vaccine. So there are many similarities, but in terms of effectiveness, we still don't have the real data yet from Moderna, which again is the next one to come. But the FDA apparently will be taking that up this week, like they looked at it last time for Pfizer last week. And hopefully we will be getting more data after that to look and see and make sure it's as effective. The preliminary things that we've seen in the press, frankly, do suggest they are very similar in effectiveness. And frankly, that's not surprising because they do work they have the same mRNA in them, just the way they're delivered is slightly different.
Great, thank you so much.
Sure.
Hi, it's Rachel from the newspaper. I had a couple of questions, but hopefully most of them will be quick hits. In terms of the vaccine, just a couple of quick things. All of the ones that you guys have received are all allocated as initial doses. This isn't where you save some of them for secondary doses, right?
That is correct. The government has said when we allocate to any individual place, that is a full allocation, and we will be sending the same amount to, roughly 21 days later.
And is it slated that you guys will have that same number coming for a second dose, or is it kind of up in the air?
Well, it really shouldn't be up in there. I mean, what we've heard from the government is that every facility that gets the initial dose should expect the second one to be identical, same numbers. I can't promise that, but that's what we've been told to understand. And we have not been told to hold back any for a second dosing.
Gotcha. Okay. And then all of the ones that you guys have received, they're all slated to go to caregivers, right?
They will go to caregivers, yes.
Wanted to make sure I had that clear. And then do you know at this point if you guys are planning on administering the vaccine to anyone who has previously been infected? Do you happen to know that?
So that's a great question. We will be offering it to them, with the caveat to say that if it's been within 90 days, you certainly could choose not to. But we want to make sure that all the caregivers are protected. And as I said, we aren't quite sure what the level of protection is for if you've been infected, particularly if you've been infected a while back. So we think it is very safe to give if you've had it before, COVID before, and therefore we are recommending that you also get vaccinated if appropriate.
Okay, and then just a few more logistical questions. One of the measures that's been cited a lot recently in terms of gauging the impact of the coronavirus has been the University of Minnesota's database on percentage of hospital beds that have been occupied by COVID patients. I saw that a lot of that's been hovering for our area around 11 to 13%. Does that sound right to you?
So that's a tough question to answer.
Yeah, Rachel, if you think about it based on our available beds or our typical daily census, we have historically here until recently been around 10%. So those numbers seem directionally correct. And then here since the weekend, we're closer to 15% of our number of hospitalized patients that are in the hospital with COVID-19.
Got it. And then the last thing I had, in terms of the external unit that you guys are working on and is expected to be hopefully up and running next week, is that going to be serving ER patients who don't have COVID symptoms, who do, or a combination of the two?
So it's for the unknowns. It's for folks who come in with symptoms that could be COVID but may not be COVID. So it's a good place to triage them and take them in, examine them, test them if we need to. So that's its function, basically. We don't know for sure if they're COVID or not, but we're looking into that at that point.
Got it. So it wouldn't be for, say, if I went to the ER with a physical injury, that wouldn't be for those kinds.
No, you would be going to the ER as usual.
Okay. Thank you guys so much.
Sure.
Hi, it's Santiago again. I just had a quick follow-up question to something Rachel just asked. If for the second round of doses, say some doses are thawed improperly and have to be thrown out, is there any kind of mechanism in place to get replacement doses for those people who still need their second round?
So Santiago, that's a great question. And I don't know, I'll be honest. I'm not sure what that mechanism would be. The hope, I will say, is that over time, Pfizer and frankly Moderna also are continuing to manufacture this, and more will be available with time. So it's a little bit unclear what 21 days from now will look like. It's likely going to look like more vaccine being available in general, for sure. But I don't know about the individual replacements of a 21 day. We'll make sure that folks do get vaccinated appropriately one way or another.
Okay, thank you.
Hey, this is Michael with WDBJ7. Just one quick question for you. How will you guys be handling the caregivers who end up showing side effects after they get the vaccine?
All right, Michael, that's an excellent question, and it's a big one. So, frankly, a lot of the side effects that happen are within the first 2 days. They're generally fairly mild, but they can, mimic in some ways COVID as well. And so what we're trying to work on is have folks schedule their vaccine, ideally not before they're working again. We'll also have an employee health algorithm to have them go over that to see, well, does this really look more like a vaccine reaction versus could this still be COVID? And then frankly, if the answer is we're not sure, testing is going to have to be part of the algorithm as well. Because, this is a very large topic and a lot discussed nationally. Because again, with our staffing being as short as we are, if we start vaccinating our staffing and need to take a lot of them out of work, that would be very problematic. Yet we also really want to vaccinate our staff so that they're protected from COVID. So it's a fine line.
All right, thank you.
Any other questions today?
Just a quick follow-up on that. I'm not sure, I might have glossed by it, but when these caregivers are administered the first round of the vaccine, they don't have to quarantine after that vaccine. They can proceed as normal.
No, absolutely not. And what I need to stress, Rachel, is that, and this is, I think folks understand that, but not always, but you have to stress that you cannot get COVID from the vaccine. There's no parts of the vaccine that really are COVID. The mRNA just generates a very small piece of the COVID virus, and it does not generate COVID at all. So that needs, and as we roll out and we educate more and more folks, that has to be stressed, because there are a lot of misunderstandings and concerns and fears about vaccines that we just have to make sure that everybody feels okay about getting vaccines and protecting themselves. So to your question, no, they do not need to quarantine automatically after they get the vaccine.
Yeah, you can't get COVID from the vaccine, nor can you spread COVID after getting the vaccine.
Got it. I just wanted to make sure that was the case. Thank you.
You bet. Other questions this morning?
All right. I think we got it.
I think so. Well, thank you, everybody. Hope you all have a good Tuesday, and we'll continue to try to keep you informed.